clinic at the Children's Hospital of Eastern Ontario, known as CHEO. And I'm also the co-principal investigator of Trans Youth CAN, which you're going to hear lots more about during this evening. And I'll move on to who's going to go next. Greta?
Sure. Hi, I'm Greta Bauer. So I'm the principal investigator on Trans Youth CAN. I've been working in transgender health advocacy and transgender health research for about 20 years. And was really excited to kick off this project with Margaret as my co-PI and with CHEO as the lead clinical site because they had such an experienced research assistant and with Margaret's involvement. So, so this is our very first presentation of results in our clinic community events and launching of our first infographics. So I'm really excited to be at this point where you're going to start seeing more results come out from this. And I'm a professor of epidemiology and biostatistics at Western University, and I hold a sex and gender science chair from the Canadian Institutes of Health Research.
Okay. So
hi, I'm Seb. I'm the adolescent health and gender diversity social worker from CHEO, and I'm doing the French version of the slides for later. So nice to meet everyone.
And I'm Annie Paulin-Sanfasson. I'm a professor at the University of Montreal. I'm co-researcher on the Trans Youth CAN, and I'm the PI on the stories of gender affirming care that we're going to discuss really briefly. And my work focuses on transgender children and their families, and I hold a Canada research chair on that topic.
Great. So you know about all of us. So now we can begin talking about what's going to happen this evening. So if I can get this working okay, I'm going to share my screen and then I'll go to putting it in presentation mode. Okay, this works. It should be okay. Is that working? Can people see the screen? Share. Okay. Is that working now? Yes? Okay.
It looks great.
Good. Okay. So you know what this evening is about. It's about school experiences. And as Greta said, we are really excited to share this with you. And this is the first topic of school experiences, and to be doing that at CHEO, since we've been part of the study from the very beginning. And we want to get all of you, share with you some of the early results of the study and the beginning of it, and also to get your questions and answers and your feedback and recommendations, what you suggest we look at further. Okay, so I should be able to just refer to that. Nope, that didn't work. Okay, this way. Okay, how about that? Okay, all right. So thank you for attending this event. We are so excited to have you here, and really thankful that you gave a part of your evening tonight to be with us. So with this event, we want to share with you information about our projects. We want to introduce you to our first infographic. You may not know what an infographic is, but you will find out soon enough during this evening. And we want to answer questions that anyone has about our infographic and these projects. You've already met all of us, so that's great. So what is Trans Youth CAN study? So it's a unique study.
Oh, so did we want to actually get a sense of who's joining us today?
Yes, we do.
Yeah, so I'm just going to launch a little poll. Hopefully everyone's going to see it. And we just want to get a sense of who is joining us today, which will also kind of help us better target some of our answers. And just so everyone knows, this is anonymous. So all we're going to see is percentages. We won't be able to identify who answered which option. Okay, so it seems like most of our audience are parents of trans or non-binary youth. So it seems about 40% are parents, 25% are trans youth, 15% are healthcare providers, 5% are non-binary adults, and another 5% are social service providers. So that's great. That's a really great range of people. We're so glad that you all joined us.
We are, definitely. I can see it there. That's great. Really good.
Okay.
Yeah, it's terrific. Thank you, Sandra, and everyone for contributing filling out the poll. So what is Trans Youth CAN? So it's a unique study, the first of its kind, to look at medical, social, and family outcomes. And important that we have so many parents in the room because, or the universal room, because family outcomes is something that's not been looked at in other studies. And we heard that early on in this study is parents saying who were decided they would join the study, that they were really thankful that people were asking their opinion and wanted to know what they thought about the process of what their child was going through. And so it's a big part of the study, as are the medical and social outcomes. It's for trans and non-binary youth, referred for puberty blockers and or hormones. It's to one of 10 medical clinics that provide gender-affirming medical care for youth across Canada, from Halifax all the way to Vancouver. And you can see on this map where the stars are the various places that clinics exist that are part of the study. So I'll give you a second just to orientate yourself to that, to the map. Okay, and moving on. So youth were eligible to be involved in the study from kind of onset of puberty and any time thereafter until their 16th birthday. So they had to be under age 16. They were recruited at their first medical appointment for blockers or hormones. They are followed for 2 years through their journey of gender-affirming medical care. And the participants complete surveys and give permission to get information on their health. And I'm just going to move this, move that a bit so I don't see all the, yeah, that's better, okay. On their health and clinical care from clinical records, medical records, and they get everything that they provide is confidential. It's really important that they're told that from the very beginning, and it's anonymized, and nothing is attached to their name. Youth could each invite one parent or caregiver to participate in the study, only one, and they could choose to invite a parent or caregiver who was with them that day. Participant recruitment and baseline data for the study were from September 2017 to June 2019. If you want to know all about our study, you can find it all on our website, www.transyouthcan.ca. So who are the participants? 174 youth and 160 parents and caregivers. The youth were an average age of 13.8 years at the first visit to the study. They ranged from 10 to 15 years of age. 76% identified as trans male, 16% as trans female, and 8% as non-binary. When asked about their background, 19% said they had Indigenous background, 6.5% were visible minority, and 74.5% were white. 24% came from immigrant families. 100% were enrolled in school, with 92% in public school, and 5% in private school, and 3% were homeschooled. 13% of these, those in school was a religious affiliated school. In terms of their parents or caregivers, they ranged from 31 to 63 years of age. The majority were mothers, 76% birth mothers, and 80% not adoptive moms. 11% were birth dads, and 1% were non-binary birth parents. The remaining 4% of parents were adoptive or foster or stepdads, stepmoms, or grandparents. 16.2% of the parents or caregivers identified as coming from a sexual or gender minority. I'm going to move on to the Stories of Gender Affirming Care project, and I'll come back to Trans Youth CAN following this. So it's a companion study to Trans Youth CAN project, and it's led by Annie, who introduced herself at the very beginning, Professor Poussin, and it looks at the experiences of trans children and youth and their families accessing gender-affirming care, abbreviated to GA, during the prepubertal, pubertal, and postpubertal stages of development to better understand the motivations and pathways, strategies to express and to address dysphoria, and navigate social and family situations. And what we sought to determine what contributes to their psychosocial well-being and quality of life, and their experiences with gender-affirming medical care. Recruitment occurred in 3 medical clinics that provide gender-affirming medical care. Those clinics identify because each of them provides care to prepubertal youth as well, whereas most of the other clinics only provide care to pubertal, at that point to puberty and beyond. And we wanted to francophone as well as Indigenous population. So the 3 clinics are CHEO at Ottawa, the Meraki Health Centre in Montreal, and the Health Sciences Centre in Winnipeg. This is a qualitative study, so smaller numbers than with Trans Youth CAN, and that's by design. It's conducted through interviews with 36 young people, and they had to have a corresponding parent or caregiver interviewed separately to them, just separate time, but to be involved, it had to have 36, well, parent caregiver as well. Amongst the youth, the average age was 14.5 years. The 5 of them were aged 9 to 12 years, that's 14%. 14 of them were 13 to 15 years of age, that's 39%. And 17 was 16 to 17 years of age, that's 47%. There were 21 not trans male and 15 trans female, and 3 were non-binary. Going on to some of the preliminary data on the school experiences from the Stories of Gender Affirming Care project. So on the left, you see the quote, and give you a second to read it. You may or may not want me to read it, but I'll go through it slowly. So the first year, this youth, Jason, who was 17 years old, said, they didn't really make the change at all. That is at school. They didn't call me by my chosen name. They didn't use my pronouns. The second year, kind of getting there, I'd still get my teachers call me miss and all that. I'll be like, okay, this is fine, this is fine. Sec 5, which is last year of high school in Quebec, they kind of, well, they didn't change my name in the system. It was a whole big thing then. Mostly it was the principals. He called me at the beginning of the year because he got complaints that I was using the guy's bathroom. He was like, can you just not use it? And I was like, okay. And then I continued using it. So what affects the youth's experiences at school? Well, washroom and change room access is a big deal. And washroom and change room that they feel safe and that aligns with their gender identity. Staff and classmates using the preferred names and pronouns, including on school paperwork. Protecting youth from transphobia. And accommodations for gym class and uniforms. And some of these schools required uniforms, and they weren't necessarily gender neutral. In most cases were not at the beginning. What are the consequences of lack of support in school? Well, all of it tells you their perspective. I just get really, really dysphoric when it comes to anything that has to do with my old name or anything like that. Like sometimes teachers will mess up because, you know, they have an attendance sheet. Before it wasn't changed, and they would mess up and they would say, sorry, sorry. And that would make me really, really dysphoric. It would go from 0 to 100 really fast. There's much more you can read about this study. If you go to Trans Youth CAN website and look under research type stories of care, you'll be able to get links to 2 of the manuscripts, which have been published already from the study, one from the youth perspective and one from the parent perspective, with some really important information that it's worth reading. And so I encourage you to look at those papers. So moving on to the Trans Youth CAN, actually before we get there, it's the first infographic. So this is the infographic I told you I would tell you about. On the left, you see a picture of it. I don't expect you to be able to see that or read it. It's too small. However, you can download the entire thing. If you go to our website and look at results, school experiences infographic, you'll see this, the whole image, and you can download it. And it's a one-pager that you can print out or look at on a bigger screen. And this is the first one that we've developed for school experiences. And it's developed by a team in London who are experienced in developing with graphics and making things look good. And they certainly did an amazing job at doing this. And I'm going to take you through it. I present on the next slides to follow. So one of the things we asked the youth about was, were they missing school? And 10% of the youth said they missed 2 or more weeks of school related per year, related to, in the last year at least, related to their gender, due to mental health issues, bullying or assault, being outed about their gender, and being misgendered. So one youth said, I was getting misgendered at school and having panic attacks. Another youth said, a transphobic student in my class assaulted me physically, and then the teachers took the transphobic student's side. And when I first came out, I did not want to go to school. I was afraid of what kids would say, as teachers had already told kids what my new pronouns were. We asked them about changing school, and had they had to change school, had thought about it, and had the parents felt that they had to get involved with respect to, for gender reasons, about their child's school. So 14% of the youth said they had to change schools because others had an issue with the youth's gender. Another 28% considered changing schools. 40% of the families had to get involved in school, their child's school, regarding gender issues. So a significant number. However, on the positive side, when we asked them about teacher and classmate support, we got some really encouraging results, which is that 98% of the youth say that teachers are somewhat or very supportive of their gender identity and expression. And 93% say that classmates are somewhat or very supportive of their gender identity and expression. And that's changed dramatically in the last 15 years since I started providing hormone care to trans and non-binary youth in 2006. Big changes there in a positive way, which is really good to see. And I see that in my clinic all the time. I hear it from the youth. And that came through in the study loud and clear, which is good. We asked them about conductedness at school, and 92% feel that the teachers treat them fairly, which is really good. That's good news. However, 70% feel that they feel part of the school, so 30% do not feel part of the school, and that's concerning. 68% agree that they feel close to people at school, so 32% do not feel close to people at school, and that's a concern. We then asked them about safety at school, and had a lot of data about safety at school. 81% agree that they feel safe at school, so that's a good news story. And they say that libraries, 93% feel safe in libraries, so that's a safe place to be, and 88% feel safe in their classrooms. But 63% were avoiding school locker rooms and school washrooms. As I said earlier in the Annie study, washrooms are a really big deal, and change rooms. 47% said that they do not feel safe in washrooms, and 33% do not feel safe in changing rooms. So that's really an unsafe place to be. And that's a big part of school. Washrooms and change rooms for gym class or for sports and not feeling safe there is worrisome. Then we look at here, you've got two sort of opposites. You've got on the left side, things that feel very safe. On the right side, things that are not safe at all. And then there's things in the middle. And this next slide shows you that. So hallways and stairwells, 79% of the youth said they feel safe in hallways and stairwells. That 76% feel safe getting to and from school. The numbers go down when you talk about school grounds, and 74% feel safe in school grounds. And 70% feel safe in the cafeteria. So although they're not as unsafe as the bathrooms and the change rooms, there's a lot of places that kids don't feel very safe. And that's clearly a lot of work still to be done. That we need to work on that to try to improve the situation for kids at school so that they can't learn if they don't feel safe. And that's so important. So what's coming up next for Trans Youth CAN? Just looking at my time here. Yeah, Trans Youth CAN. So there are more infographics to come. Parental support is next. So that's going to be in Montreal in late September, and looking at parental support, and Annie will be leading that along with the team from Montreal site, and with a similar event such as tonight and a new infographics. There are more topics coming in the coming months, and if you watch social media and our website, you'll hear what those are, and we're interested in what you think they should be. You can give us some input on that. We don't know if we can respond or not to say we do them, but always interested in input. There are 4 papers already. As with any study, it's really important from an academic perspective that we publish the information so that other health professionals learn about it, so other families can learn about it, and the youth who participated in this can learn what the answers have been from what they've been involved with. Politicians can learn from it too, and all the various people out there. So we've got 4 papers that are in the works right now and hopefully soon to be published. One is on the youth characteristics in the first visits that they had, the baseline visits. And that's looking at social demographics, health, social context, and the first visit outcomes. And Greta's leading that paper. The parent caregiver experiences is one that Annie's leading. And that's looking at stresses on families and others, family functioning, and parental conflict. Pathways to Gender-Affirming Care is one that I'm leading, which is looking at timelines to care and the wait times, how long people are waiting to get seen in a gender-affirming clinic. We know it's longer than it should be, but what are the barriers preventing people from getting care when they want it and need it? And who have they seen before they get seen in the clinic? Are they, what kinds of healthcare providers and how many? And it varies significantly across the country based on what's available, and also there's different practice patterns across the country. And then to see whether, not we're saying one way is better than another, but there are differences. That was one of the goals of Trans Youth CAN, was to look at the various models of care and access to care across the country. And then the final paper is looking at gender distress and gender positivity measures. And these are new measures that we developed in Trans Youth CAN to look at us, allow us to look at the positive aspects as well as the distress associated with gender identity, and to separate feelings related to the body from feelings related to social gender. There are many more papers to come, but those are the first 4 that will be published. And as we continue to work on the others. If you have other questions, I'm missing from questions I just noticed, then you can contact us on the website as shown here. It's regular website / contact. And then again, / there. Okay. I want to thank the various members of our research team. So you know about Greta and me, the co-investigators for the 10 sites are shown there, as well as people who are not part of the 10 sites, but they've been actively involved in the study in a variety of capacities. And they're listed here as well. They come from different aspects of medical care and social sciences, clinicians, and then there's collaborators. Lorraine Gill from Children's Aid Society in Toronto, and Simon Chappell, who's a psychiatrist at Winnipeg Children's Hospital, Manitoba. The site staff are from the 10 sites, and if you're from CHEO, you recognize some names there. And the site team members are also listed, of which there are many across the country. There are 3 students listed, from master's PhD students who are involved in the study. And that's a big part of the study, is to help train future researchers in trans youth care. And then the additional collaborators who are involved. So you can see it's a very big study team for a reason. It's a complex study and involves input from numerous different people. It also, really importantly, it involves the youth, input from youth and parents. 19 youth and 9 parents who provided feedback on the survey items. This went on for months before the study first began, recruiting patients, participants, both in English and French groups. 6 youth and 7 parents were also involved in the community consultation committees, which is really important. We want to thank our youth participants, all 174 of them, and our 160 caregiver participants, without whom the study wouldn't exist. We are so thankful, grateful to them. And our funder, which is CHR, that's the main funder for medical research in Canada, and we're really grateful to them for funding this research, who again, wouldn't have happened without them. And with that, I think, before we get to the last Q&A, so this is the logos for the websites or for each of the clinics, as well as the universities that they're affiliated with. And you can see across many across the country. So this is a big effort from a lot of people, all invested in understanding what the experiences of trans and non-binary youth and their parents, and determining what is affecting how they get to care, the care that they receive, and the outcomes from that, and learning from that so we can provide better care in the future. And we're grateful for you for being here tonight, and for everyone involved in the study from the very beginning right through until the very end when it finishes in many years from now. And with that, I think that's it. We can open it to questions at this point.
Yeah, so a couple of people have already submitted questions, but I'd encourage anyone else, if you have questions, to submit them using the Q&A, or you can also put them in the chat. Just be aware that whatever you put in chat, all attendees can see.
Right. So maybe, Margaret, can you want to stop sharing your screen, and then our images will be larger and we can, as a group, answer there. So those of you who are on small screens will function a little bit better this way.
Mm-hmm. So maybe we can start. We've had a couple of questions about gender neutral washrooms and just views on gender neutral washrooms and gender neutral change rooms in schools. So do you think schools will include more gender neutral washrooms, and just what your views are around gender neutral washrooms and change rooms in schools?
Well, I'd be happy to start with that because I think that there's a lot of evidence, not just from our project, but it's been pretty consistent that the more gender segregated spaces are the ones that people feel least safe in. And so there really needs to be work done in some of that structural work, you know, as new schools get built, for example, and creating spaces that can be safer for people. And but I think it's important to have those spaces at the same time. And I'll say that I'm not a lawyer, so that's my disqualification here, but I have done a lot of work on human rights policies around gender identity and expression. And it's one thing to have a gender neutral space. It's another thing to try to force all students who are trans and non-binary to use some alternative space, because human rights as it stands allows for inclusion and accommodation, and that doesn't mean separate facilities or that people should be forced into them. So I'm a big supporter of gender neutral spaces, either as universal design, the ways that we can design washrooms for universal accessibility, we can design it for universal gender accessibility as well. And also a big supporter of having options for people to make sure that, from a health perspective, it's not just psychological. There are real issues with people holding their urine or dehydrating and not drinking enough because of concerns around